Like many here this evening, I have seen firsthand the ability of the arts to improve mental health. Community Jameel was honored to support the launch of the Iraqi Cultural Health Fund, which supported Rashid Salim's Arc Reimagined project as the first ever Iraqi participation. Arc Reimagined delves into Iraq's deep past while tackling the very immediate mental health challenges of the community in southern Iraq, from conflict and the ecological collapse to the challenges posed by the pandemic.
As the pandemic has reminded us, our well-being is contingent on our interdependence and our capacities to collaborate across borders. So the NYU Creative Arts Therapies Consortium brings together expert researchers from across 7 universities, University of Melbourne, Haifa, Edge Hill, Drexel, Lesley, Heidelberg, and NYU, to advance our understanding of the benefits of the arts and creative arts therapies, such as art, drama, music, poetry, psychodrama, and drama therapy. And we've been working closely with Christopher Bailey in support of the Arts and Health Agenda at the WHO to map the evidence for the arts and arts therapies in promoting quality of life for individuals and communities and addressing specific health concerns such as depression, dementia, and anxiety.
We know that Alzheimer's and dementia are big and growing problems in our society, and we've been supported by Lady Wolfson and Mind to work particularly in terms of those suffering Alzheimer's, making sure that they have access to the museum in a controlled and fulfilling way. I think this intergenerational point, again, which we've lost during lockdown, those terrible scenes of grandchildren not being able to kiss or hug their grandparents and the loss there. And there's nothing more beautiful than when I come to the V&A and I see a granny taking her granddaughter around our fashion galleries and introducing her to this kind of history and this material culture in a sort of open, free-flowing way, and both of them enjoying it so much.
Everything you just said, every single one of you, I agree with, but then it comes to me and I have to stand in front of the chief financial officer of a hospital and I say, this is what we need to do and you need to give us the money. The biggest problems in healthcare, contemporary healthcare, are access and costs. And what Ed just said, there is a way how you can correlate saving the costs in healthcare by bringing the arts. So if somebody asks me, why do you buy art and why do you bring arts to the hospital? You're spending money? No, we are saving money. We are actually saving money.
My conclusion is that there is zero leadership in this area. There is not a single government I can point to which takes this issue seriously and understands it and wants to lean into it because they're frightened of being mocked and traduced for supporting lobbies and ethereal arts, and they don't understand the incredible impact that the arts can have if they really get behind them.
I found myself in the gallery where these epic Turner paintings were displayed. And you know, the ones that have the epic seascapes of storm and waves and ships and the spray. And when I suddenly realized where I was and what these paintings were, I was taken aback, and I felt the saltiness on the tip of my tongue, and I realized it wasn't the salt spray from the paintings, it was the tears coming down my cheeks. Because for the first time in my voyage into blindness, through Turner's vision, I actually saw in those paintings how I see the world, a future that is more than just managing a difficult situation, is transcending it, it's transfiguring it. And that can be done through art. And that voyage has a name. It's called Hope.
I wanted to do something that was about refugee crisis, but working with refugees. Once you put someone literally on a pedestal and their head is modeled in a sort of semi-classical way and it's in a kind of stone-like material, or concrete in this case, you suddenly project so many things onto them. They must be important, they must be there for a reason, they must have done something, which are all true. Everyone's lives are important, but it's a counterbalance to that idea of seeing refugees as huddled masses, as being undifferentiated, as being like, you know, not human.